I had the lap band 6 months ago. It's wonderful. I love it. I love every moment of it. I ran for the very first time about 4 months ago, my very first mile. It was the best feeling I've ever had. It was wonderful. I can't express the feeling it was when I finished that first mile. I'm now training for a half marathon for the first time. It's great. It's great. I want to lose about 60 pounds more before I stop. I don't really have a weight I want to stop at. I just want to be healthy. And when I'm out of that obesity range, then I'll be happy. I have always been heavy since I was a small child. It's just in my family. It runs on both sides. Both my father and mother, their families are heavy. So it's just been an issue. And I've tried every diet, everything. Even as a dancer in high school, I was always a heavy dancer on the dance team. And it was hard. And I love dance. Dance is a passion. So that's my goal. Dr. Ellner asked me during our orientation, what is your goal long term? And I told her I want to dance again because I couldn't dance anymore when I was so obese. It's a huge difference. I have a 4-year-old and I can play with her. We bought her a trampoline for Christmas and I was over the weight limit on the trampoline. I couldn't jump on there with her. So on the trampoline now I can jump with her, I can play with her, and it's a great form of exercise too for me. So I use every opportunity as an exercise thing. So we can go hiking, I can jump on the trampoline, I can do multiple things with her that I couldn't do before, which is great. And she's in dance also, she's on team dance. So now I can put on my tap shoes and tap with her on the outside, and I couldn't do it before. And it's heartbreaking as a mom to have your child ask you to do something and you have to tell her no, and you don't want to tell her because I've made choices in my life for food that I can't be active with you as a mom. Men, it's so weird to walk down the street and have guys turn their heads and ask you for numbers, and I'm out running and I have cars honking at me, and I think somebody's gonna like crash into me because I hear honking, and then I realize they're honking at me for me, and it's a really good feeling to know that you're wanted for the first time in your life. My husband's great. He's loved me through thick and thin, but it makes me happier in my marriage now that other guys want me too. And I think it makes him appreciate me more. There is definitely a lot of jealousy. We just got back from Las Vegas and he kept holding my hand the whole time and trying to hold on to me because he got very upset with all the guys looking at me. But I love it. I think it's great. I have no problem with it. Keep them coming. So for the first time in my future, I see happiness, I see health, I have goals that I've never set in my life before. I've always been a career woman. I'm a branch manager for a bank, so I'm very independent on my career goals, but on health goals for the first time, it's great. Like I said, I'm going to run the half marathon, and there's nothing that can stop me from that goal, from obtaining that goal. Now, I also have a goal to, get down to a single-digit number in clothing size. I will get there. I don't think I'll get there. I know I'll get there now. Now that I have the tool that Dr. Ellner gave me, it's wonderful. She's amazing. The best impression I got from Dr. Ellner was I remember waking up from surgery and she was still standing there to make sure I was okay. And that's huge. Surgeons don't stand around and wait for their patients to wake up. They have nurses to do that. But she was there, and she's never not been there for me. She's been there every step of the way. Every neurotic moment that I have, when I see that scale go up, she's there to calm me down and bring me back to a level that it's still life and it's not a magic trick that my weight's gonna go away. It's reality, and it's something I still have to deal with, but she's there for me, and that's what makes the difference for her as a surgeon. I don't talk to a nurse. When I call, I talk to Dr. Ellner.